Hello, welcome to the Catalyst Podcast. I'm your host, Charles Epstein. Today, we're going to be taking a virtual trip to Chicago. Belinda, how cold is it in Chicago today? I'm curious.
Believe it or not, it's 40-something. Woohoo!
Oh, wow. Wow. Very, very nice. So only two layers. That sounds
Right,
like
exactly.
2-layer weather.
Right.
Yeah,
Two layers, one office heater.
Okay. That makes sense. Anyway, today I'm delighted to be joined by Belinda Willis, Evaluation Director for Chestnut Health System. Belinda has over 30 years of research, program evaluation, database management, and administrative experience. And on a daily basis with Chestnut Health System, she manages multiple projects from budgets to data collection and oversees the Chicago office and staff. Belinda, I really do appreciate you taking the time and speaking with us today.
Thank you so much for the invitation. I'm pleased to be here.
By the way, I'm going to avoid the temptation. Anytime you speak with somebody from Chicago and you happen to be from New York, I am from New York. I think, to have real discerning ears to hear that Long Island accent, I don't think. By way of South Florida. So, of course, the inevitable conversation goes to who has a superior pizza. But we're not going to go there, Belinda.
I appreciate that.
We're not going to go there because I think that would take us down a complete rabbit hole. Okay, so you've actually been with Chestnut for 30 years. And, 30 years at the same place of employment is kind of an anomaly in today's world. But what's kept you there so long? What's kept you from exploring other avenues? I'm sure you've been tempted, no?
I can't say I have not. But I think one of the things that I enjoy working at Chestnut Lighthouse are the different types of projects that you can work on. I mean, I started out as a data manager, and over the years, we range from program evaluation to doing our own clinical trials. And some of the clinical trials have been so interesting, involving smartphone techniques or methods to research addiction treatment methods, to utilizing iPads. And each one, I get a chance to say, oh, you know what? I want to do that. I want to be involved in that. And the principal investigators, they're like, fine, go ahead and do it. We know you can do it. Go for it. So that really keeps the excitement going for me.
Sure. No, that makes perfect sense. So I need to ask you, what does an evaluation director do?
So pretty much what we're talking about program evaluations. And what that involves is that we normally work with a lot of the community-based providers in the area. And what they do, they provide comprehensive services like substance use treatment, mental health treatment, and a good portion of these services are provided through grants. So stipulation of the grant is that the services are monitored, evaluated by an external evaluator. That's where we come in. We usually assess the program's progress during the course of the grant. We evaluate the programs to determine if the goals and objectives that were stated have been achieved by that provider. As an example, a provider may specify that they're going to serve 100 clients over a course of 3 years, and they're going to provide certain services for these clients. Well, we monitor and document the actual number of clients being served and the actual services that were provided to individuals.
Okay, well, thank you very much for solving that mystery, Belinda. I appreciate it. I'm curious, what led you to this work? I'm hearing that you were at core kind of a techie.
Correct. So when I started, I don't know if it's a funny story, but it was funny to me anyway. I started as a data manager in this office. And when I started working here 30 years ago, I came from the environment where it was DOS. And so Lighthouse, Chestnut.
We're dating ourselves, Belinda. Let's be
careful. I know.
Please.
Seriously. So this was my first time using a mouse. And it was very intimidating. I'm like, what the heck is this about? And so from then I learned database management. And again, my mentors, Dr. Christy Scott, Dr. Michael Dennis, they've been encouraging me over the years, influencing me also in the different areas. And because they're such strong advocates of using research and training to improve the, addiction services, I've just been drawn into this. And the switch is data, the evaluations, they all play a part. I need the data to prove that the providers are doing what they say. And the data also influence where where we're headed, where we should go next. So I don't think I'll ever give up data, but just moving through the course, I don't know, maybe it's a life course. I don't know. I don't know how to put it. But this is my journey.
By the way, it's funny, my daughter, who, she now is in her early 20s,
Okay.
of course, she and her generation, it's all Mac, 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 and she has no respect for Android or Windows, but she has no understanding, as I'm sure you do, if you grew up and cut your teeth on DOS, Mac is just really not a path that's open to you. I don't know about you, but it just, you go with what you know.
Exactly. It's like, okay, so now I'm assimilated into this Windows world and, part of the company, there are several users of Mac and I was like, oh, this should be interesting. I'm like, I don't know. Maybe.
Right,
I have to get in that mindset.
Have you ever taken that leap or are you still Windows based?
I've thought about it. I have not.
You thought about it. You thought about it, but then you thought better.
Yeah, maybe not.
Yeah, same. No, I've been Mac shamed for a number of years by my daughter, and it's not fun. But I'm gonna stick to my guns. In your 30-year career with CHS, and by the way, I don't want to make our mutual age a subtext of this conversation. I was reminded by somebody that we've known each other for 2 decades. And I said, you know what? That sounds like a very long time. Couldn't you have simply said, 20 some odd years or close to 20 years? It's all in the impression you create. Anyway, in your 30-year career with CHS, what major lessons have you learned along the way? How has the field changed over that time and what's driven that change? And I know that's a very, very broad question. So answer it however you think you feel comfortable.
I think one of the major changes that I see is technology. Even starting from DOS to Windows, that's a leap. And developing databases using the software that's available. When I started here, the person before me had all the information in Excel file. And I'm like, oh my God, we're talking thousands and thousands of records. You really can't handle that efficiently using Excel. I mean, Excel is wonderful, but to manipulate and you really need a database to do that. And then over time, when we're talking about using smartphones as the way to communicate with clients, telehealth, things like that. I mean, technology. I think right now, I believe they're even thinking about using AI as a way to deliver services too.
Yeah, which makes sense. I know it's kind of controversial in the field, AI, how much you could trust it, how you could, will it supplant certain traditional interactions? I'm sorry?
I said I won't say thoughts of iRobot. It's coming by.
Yeah. And every day there's a new piece of news that's either amazing or shocking, and usually it's both simultaneously.
Right. Yes.
So it's an interesting thing. Now I want to get back to program of evaluation again, which is core of what you do, and you touched on how you work with providers and external partners to ensure they follow grant guidelines. I would expect you to do that, but sort of as an outsider looking in, are there some things that I'd be surprised about, or some things that you encounter on the other side working with these people? What are some of the things that would surprise me about your work with providers and external partners ensuring they follow these guidelines? usually run up against this. This is something, people have this perception or
Yeah.
preconceived notion, but
Yes.
actually they think it goes this way, but it actually goes that way.
Right. I think one of the things that I noticed early on when I started program evaluation, and what I would do was go over to the agency to meet the clinical staff involved and explain to them what I'm there to do. At times, first you're thinking, you can see in their faces that, okay, this person is out to get us. And so at that point, you have to explain, no, what I want to do is to make sure that this program works for your clients. So I want to offer you feedback, timely feedback, so that you know if you need to change something. This is not a I'm out to get you kind of thing. This is more or less like, let's improve this and make it work.
Your LinkedIn page highlights your interest in data management. Again, you touched on that, involvement in clinical trials. You spoke to that a little bit. What could possibly be so fascinating about data management? Tell me a couple of things that would make me go, oh, you know what? I missed an opportunity. That could have been a really interesting career path for me.
I don't know how I can explain to somebody what fascinates me about numbers. I think you have to pretty much have that mindset. I couldn't really talk you into, you need to go into this direction with data collection and data management because this is so cool to look at databases. It's learning how things progress over time. You get your first 10 clients in, you look at the data, oh, wonderful. And then you're looking at thousands and thousands. And the frequencies, you look at crosstabs, demographics. And to me, it's just fascinating. Well, maybe that's the wrong word, but it's interesting to see how a person will start the process or the beginnings of a program, and then to look at them maybe 6 months later and see what progress that individual or a group of individuals have accomplished. And especially in the area, let's say substance use treatment, maybe they were using a high level of some substance. Well, 6 months later, you can see that has totally decreased or decreased enough to say, yeah, that program is on the right track.
In a way, what you do is you're able to see the story and the data, the narrative. You're able to see how it all sort of comes together.
Yes.
Do you get better and better at that?
I think you begin to understand what to look for, depending on the project or the study that you're working on, and you know what questions may be of interest to what I would call the principal investigator or the individual that's leading the project. And that way you determine what variables to put in your table so that you can enrich their story, their storytelling on their end.
Yeah. What would you say perhaps to the younger Belinda Willis or somebody who's perhaps entertaining the idea of entering this field?
I think I would say be patient. And what I do tell people when they're, start work, I'm like, you were not born with this information. So I'm not requiring you to know it at any point in time. It's a learning process. I mean, what I know, I can tell you, but I cannot show you. You will have to learn, and you will learn your own way. I will give you the tools to do this. But everybody will, you do different things. You make a bet different than somebody else. Well, you're going to manipulate data or look at data differently or design your database different than I am. I'm not saying it's any worse than mine or any better than mine. If the results are the same, then we've accomplished what we needed to.
Yeah, it is kind of interesting. If there is any through line with all the interviews I've done thus far with your cohort from Chestnut and Lighthouse, there is method to the madness, but there is a great deal of improvisation required in what you do. That could be anything from, interpreting the data or, as you're sort of saying, finding the narrative in the data that does, I think, require a certain mindset or a certain level of creativity, not specifically improvisation, but the people out in the field, they're called to improvise a lot. It seems to me that, you have to be prepared for that. You have to have a certain mindset, but it also kind of, I asked you at the outset, what's kept you there for 30 years is the variety. It seems to me that improvisation sort of goes to that, keeps you sharp, keeps synapses firing.
Yes. I mean, it's always that. Yeah. To me, it's like, I think one of the things that the field director and myself, when we are interviewing folks, we often let them know that you're not going to have the same day in a week. Always something different. Always.
And that's not for everybody.
Correct. Exactly.
Yeah. It's interesting. So what exciting projects, you sort of hinted at several at top. What exciting projects are you currently working on or that are in the pipeline?
Right now, I think one of the ones, a different one that we haven't worked in the past it's a supportive employment project. And what that involves is one of the providers are enrolling individuals that have serious mental health disorders, but individuals want employment. So there's that piece of making sure that they're supported, by a mental health therapist and engaging them in all the activities one would do to seek employment, filling out a resume, completing interviews and whatnot. That is very, very interesting. I did not know. And then I didn't know that there's a whole agency. Illinois State has a great support system for supporting employment behind that. And they often come out to agencies to show them how to engage individuals and be successful, which I think this is just a pilot project for me. It's really good. And they're on the way to success. I can see that already.
Oh, okay, great. Anything else?
Well, one of the ones we're doing is the Illinois State's response to the opioid epidemic. And that involves a lot of providers across Illinois, which enroll individuals seeking services, different types of services. Our part in Chicago, out of this office, we have an outreach team that are in the community that's hardest hit with opioid. And they're engaging individuals on the street, asking them if they need help, if they want treatment. If they say yes, then we will bring them to our office and begin to link them to a facility of their choice and try to get them in there within 24 hours.
Excellent. Belinda, I really enjoyed speaking with you about these things, and I really appreciate that you were able to take some time out of your busy day. All of you at Chestnut Lighthouse, you got your hands full doing a lot of great and important work, so I do appreciate this.
Thank you so much for having me.
Of course. Today I spoke with Belinda Willis, Evaluation Director for Chestnut Health Systems. Belinda has over 30 years of research, program evaluation, database management, and administrative experience. On a daily basis, she manages multiple projects from budgets to data collection, oversees Chestnut's Chicago office and staff. She joined us today naturally from Chicago. This is Charles Epstein from the Catalyst Podcast. Thanks for listening.